It's 5 o'clock, the time that we get together every day, provide an update on the coronavirus, but more importantly, that we commit as a Commonwealth to doing everything we can to defeat this virus. So let's start the way we always start, by knowing that we will get through this. We will get through it together. I want you to say it with me, because when we say it, we believe it. And given things are going to get tougher before they get easier, we're going to have to be strong. So let's say it together. We will get through this. We will get through this together. One more time. We will get through this. We will get through this together. And we're going to get through this by making sure that we follow, and I'm helped today by both Virginia and James. James, if you'll put up the 10 steps, by following the 10 steps to defeating this coronavirus, and that is staying healthy at home. Folks, as you're going to hear later, this is a tough day for us on just about every metric. Staying healthy at home is the best way to protect yourself and is the best way to protect everybody around you. Other than going to work, getting supplies, getting some exercise, we need you at home. That is your duty. As a patriotic American and as a member of this Commonwealth, it's the way that you can help other people. We need you to avoid crowds and gatherings of any size. Every crowd and gathering is an opportunity for the coronavirus to spread, and what we're seeing now is it is spreading in just about every crowd and every gathering. Got to practice social distancing. If you're in the grocery store, if you're in Walmart or Home Depot, Lowe's, you pick. We need to make sure that it doesn't become a social hour and that you stay 6 feet apart. If it looks like there's a crowd at any store, you don't go in. We have to get this right. Knowing when to seek care. And we're going to hopefully in the next couple days provide another update on that. But that's that if you are well but nervous, you call our hotline. If you are sick but would have not otherwise sought care, call, don't go to your health care provider. But if you are truly sick, or injured, make sure you get the help that you need. Our website, kycovid19.ky.gov. That is the definitive source for information on this virus and our guidance. Make sure that you use that as a way you get information and not social media. Wash your hands and surfaces. We got to continue to point this out, that especially as we are seeing a surge, wash your hands often. Protects you, protects others around you. Disinfect surfaces at home or at work. If you can't find disinfectant, use the 1-100 bleach solution. Apply for benefits. And tomorrow I'm going to have an extended period of time where we have Josh Benton to answer questions. I know that there are people frustrated with our system. Our system was designed to where if you fell in categories like being self-employed or being an independent contractor, you didn't qualify. We have expanded eligibility, but we're still trying to get what we'd call a legacy system, an old system that was designed for a different time, up to speed. I promise you, we are going to get this right. We do need some patience, and I know that's hard. I know that's hard at a time of uncertainty. We will get it right. Prioritize your mental health. As you know, the president has now extended their guidance through April 30th. I think later this week we'll have an update on where we're seeing extending different deadlines for the state. But that means we're going to be in this for at least the next month, at least. And we're going to need to be strong to do that, to continue the social distancing, to continue the healthy at home, especially as it gets nicer outside and we haven't seen people that we like in a long time. It's going to take that true strength and resiliency to make sure we keep doing what we need to be doing. Do not travel. And we put out an order yesterday that's about traveling to other states, but don't travel anywhere. I mean, at this point, if you're not going to the grocery store or you're not going to a job, don't travel anywhere. It's very important to defeating this coronavirus. And finally, the opportunity to report noncompliance. Remember, the reason that we are doing this is if we reduce our contacts, we will ultimately flatten that curve and have the health care capacity to help people that are sick. Let's go back to that very first Seattle line graph that we used for a while because while it is now a little outdated, it is still very important to see. When you look at the number of infections based on the amount of contacts that we cut, we can, through social distancing, and that's the one thing we don't have to rely on anybody else for. We don't have to rely on anybody providing us test kits or PPE or anything else. The social distancing, is the one thing we as Kentuckians can do without help from anybody else. That means this ought to be our primary obligation and focus. And just look at the difference between business as usual, which is the blue line, and ultimately the red line, which would be a 75% decrease in contacts. This is how we protect our friends and our family members. And just look at the delta, the difference in between that blue line and the red line. I'm going to tell you those are lives. Those are people that aren't infected. That is a big difference. So if you haven't cut your contacts by 75% or more, I want you to think about how you will do that because that is your duty to make sure that you are doing everything you can to protect the people around you. Let's show our animation, Philadelphia versus St. Louis, now versus Louisville again, so we can see how this is going to unfold. Right, so this is if you do nothing, if you don't engage in social distancing the right way, Philadelphia didn't do it until it was far too late. What happens? You have a huge spike of cases. It overwhelms the healthcare capacity, and you have a lot of people that you lose. We're already taking steps to make sure that won't happen. Let's show St. Louis. So what St. Louis did was immediately, and I believe we also immediately acted to make real sacrifices that you, the citizens of Kentucky, are making. It's the closing of restaurants and bars. It's the limitation of travel. It's the closing of in-person traffic to forward-facing businesses. They are all the things that we're working every day to do. And what that does is it decreases the spike, the surge, the number of hospitalizations or ICUs or ventilators that'll be needed, and that protects more people. But again, what the St. Louis model doesn't have that we have to have is resiliency. So if you'll show Louisville. So what Louisville did, and again this is the Spanish flu, is they did not react as fast or as well in the beginning as St. Louis, but they did have more resiliency to make sure that when this virus reemerged in the fall, and we will have at least a reemergence in the fall, that they were persistent enough to ensure that they still had the ability to put things into place, even if they had relaxed them, to better protect our people. So we got to be like St. Louis in the fact that we have got to reduce our contacts. We've got to flatten that curve, but then we got to be stronger. A lot like Louisville was during the Spanish flu, about making sure we're resilient enough and that we keep it up long enough to truly make the difference that protects people's lives. Now let's show the CDC map. I believe this is this is their most updated map, and it shows cases increasing significantly around the country. There's a surge in most places. And what we see is that while we are faring better than most, our cases are increasing too. But it also gives us the idea that acting aggressively, reducing our contacts, can make a difference. We can better protect ourselves. And now some of the uncertainty here is none of us know, because not even New York has reached their apex, has reached the top of their surge. None of us know exactly how widespread this is going to get. But what we do know is whatever that amount is, we can reduce it by what we are doing right now. And I know uncertainty is the hardest part of all this. It is. It's the hardest part in planning. It's the hardest part in living. It's the hardest part in staying strong when it's really nice outside and you want to go see people. But what we absolutely know is that our resiliency, our following the guidelines works. And the larger that this virus spreads, the more potent it is, the faster that it proves to spread, the more people we will save and protect. by cutting our contacts and by doing this right. Now, quickly, before I get into our update from today, I do owe an apology to U of L's head football coach, Satterfield. That was my mistake. It was just my mistake. I never planned on being on TV an hour a day, every day, based on notes that I write in pen. I apologize to him. He was a great sport about it. Didn't care, just wanted to make sure that Kentuckians were doing what they ought to be doing, but it was meant as no disrespect to him or the university at all. And I'm going to mention in a minute the U of L, while we've talked about their lab and in some instances on communication, their capacity has increased significantly, and they're going to be helping us out over the next couple days. We appreciate that as well. All right. So today's update, and I'm going to do the update before the good news, which we're going to put at the end to pick ourselves up a little bit, is a tough one. So this is our largest day of new cases. We have 114 new cases, and we also have 6 new deaths. Now, we knew this was coming, and we know there are going to be days where we have more than 114 new cases. And there are probably going to be days, folks, where we have more than 6 new deaths, and that's going to be hard. But that is what this virus is, and that is why we are working so hard to reduce our number of contacts and protect the people around us. We were prepared for this. We can breathe. We can take it in. And we can know because of it that we're committed to working harder the next day, to hope that we don't have another day that's this big, but we know we will because we are in that slope where the virus increases. Our new cases are 58 in Jefferson, 17 in Fayette, 4 in Hopkins, 3 in Jessamine, 2 in Kenton, 2 in Shelby, 2 in Davis, 2 in Edmondson, 2 in McCracken, 1 in Christian, Campbell, LaRue, Graves, Clark, Madison, another in Christian, 1 in Montgomery, Laurel, Pulaski, Russell, Hancock, Muhlenberg, Hardin, Rockcastle, Henry, Scott, Union, Carroll, Woodford, Bourbon, and Anderson. And I know there's some first-time counties in there. And to those that are out there, that just means this is your first confirmed case. We have known that there are people that have the coronavirus in your communities. Remember, most people are asymptomatic. So this just says to everybody out there that we've got to treat every community like the coronavirus is already there. And thank you to our county judges and our mayors and our magistrates and everybody out there that has already, I know, internalized this and is working under that model. Our deaths today, that we learned about today at least, are an 88-year-old female from Fayette, a 74-year-old male from Bullitt, an 87-year-old female from Jefferson, an 81 female from Jefferson, a 74-year-old male from Jefferson, and a 66-year-old male from Jefferson. To my knowledge, all of these individuals had other factors, but the coronavirus was a factor. This is what this virus does. The folks that are suffering, that are in our vulnerable population from other issues, but issues that our citizens can live with day to day. This is the group that it impacts the most, and that's also why, and when you don't follow the guidelines, when you get together with people and you may think it's harmless, maybe because the age or the health of the people that you're getting together with, that doesn't mean that they don't then interact with somebody else who interacts with someone else who interacts with one of these folks. So please, let's redouble our efforts. Tonight I'm going to be lighting up the Capitol and the Governor's Mansion green, and I'd ask as many people out there to do it as possible. And if some folks out there that haven't been will start, though we have seen a lot, we'd appreciate that. Today we lost 6 Kentuckians, which is something that I hoped that I would never have to announce, though I know I will be announcing it more as we move into the future. Let's make sure that we honor them, that we show compassion to their families, that we show that green color of renewal, because at least in my faith, their spirit is merely leaving their body to a better place. Let's make sure we can console those families, and we remember that more than ever in our lives, every decision we make has consequences on other people, even people that we don't know. We are more interconnected, even though we have to stay apart, than ever before in this Commonwealth. And so everybody is depending on you. Each individual out there that's watching or not watching, everybody out there is depending on you. Let's make sure we do the right thing. Let's make sure that we get it right. Given this report, I'm going to ask Dr. Stack to come up to talk a little bit about where we think we are, how this surge is here, and then we're going to talk about some new steps we're taking, and then we're going to move into the positive things that folks out there are doing. I want to do it in this way, so again we can get that recommitment after a tough day, knowing that we can't let a bad day get us down in terms of our compliance. We've got to make sure that days like this motivate us, that we send our thoughts and our prayers to those that we've lost, and we mourn. But at the same time, we're stronger coming out of it and more resilient and ready to start tomorrow, reducing our contacts further and doing everything we can to defeat this coronavirus. Steve?
Thank you, Governor. I always believe perspective is important in this, and so just like the governor says, the vast majority of us are going to be okay. I just want to remind you, 80% of people are going to do just fine, and kids, for a number of reasons, children appear to be relatively spared. But that being said, there's a significant portion of us who may not be okay. You can watch the news and look at it just like I have, but some of my friends and colleagues from around the country were sharing how there are field hospitals set up in Central Park in New York City now. And if you would have asked any of us in healthcare if you could imagine physicians putting breathing tubes in people in the middle of Central Park in field hospitals, it would have been inconceivable. I talked to a childhood friend of mine who's an infectious disease specialist in New Jersey on the outskirts of New York. And she's a pediatric infectious disease specialist. And they have essentially shut down in the hospital where she works all of the pediatric care except for a very limited amount, and it is all gone over now to coronavirus patients in adult care. Folks, it's not a game. This is for real. And I'm really proud of what we've done in Kentucky, because all the stuff that the governor has shown you, the curves and the graphs that he's shown you, show that hesitation hurts a lot. So you have to act boldly, and you have to take significant steps. We've done that in Kentucky. I still have friends, medical professionals, and others who are just concerned in the community who reach out to me and say, should we do more? Should we lock down more? If you do the things that we have already asked you to do, we're going to be okay. If you do the things like not travel out of the state, please don't try to visit nursing homes and prisons and hospitals. My friend in New Jersey even said they're doing the exact same things, but if you go into a hospital, there's only one visitor, everyone has to wear a mask, and they're fever checked in the hospital, and you're not allowed to leave if you're the visitor until your loved one goes home. This is how serious this is, because the problem is it's so contagious for other people, and once it starts to spread, it spreads rapidly, and then we have a serious problem with not being able to control it. So I have to, again, thank you all for your kindness, your care for each other, for your love for each other, for your Team Kentucky spirit, because the massive outpouring that we've received from so many people trying to do the right thing and being concerned for others is really, really inspiring. But if we don't do these things, there's a lot of folks going to get hurt. And the governor has to stand here and tell you each day these reports that sadly, even though they're much better than many of our sister states in the United States, still are not what we want to say. Now I want to give you a couple little factoids too. There's been some reporting or some discussion perhaps around the country that the numbers aren't going to be as bad as they could be. I just want to urge you to be cautious. I think there's some underestimation that may be going on, and I really have to urge you not to accept that underestimation. Otherwise, the risk is going to be so much greater for everybody. We'll give you more updates as we go along and try to make that more clear, but you really have to follow this advice. I don't think anyone should be thinking we're out of the woods yet as a community. The second thing is there's been some discussion about masks and when to use them and when not to. Now, all of this guidance is going to continue to evolve as we learn more and as the situation changes. But I'll tell you, if you are sick, you should self-isolate, stay at home, and don't leave your home unless you really feel you need medical care, and then first try to call on the phone or get medical advice by telemedicine if you can. But if you need care, then seek it. If you are sick but otherwise well, you should probably be wearing a mask on your face, because then the droplets, the secretions when you cough or laugh or sneeze, those things don't spread to other people. But because these masks are so scarce and because the evidence is not at all compelling yet that just wearing a mask in public is going to protect you from walking around in the open air, I would ask you still not to be just randomly wearing masks walking around in public, because you're taking masks that are needed for the healthcare workers who are providing care to the sickest patients. So if you're sick, you might wear a mask to keep your secretions to yourself. But in general, let's please all pull together and save those scarce masks for the healthcare workers. And in closing, I want to really continue to thank the doctors, the nurses, the respiratory therapists, the firefighters, all the first responders, and the other healthcare clinicians I haven't mentioned. They really are on the front lines. They are putting your needs ahead of their own angst and their own worries. So please be kind, be thankful, be patient. We are going through times which are going to ask and demand of us to adjust to different types of medical care, different levels of expectation for when we can visit, when we can't, the type of care we get, how quickly we may be screened and moved on. Please, they're doing the things they need to do. They're doing the things we've asked them to do. I just ask your patience and your understanding. We're going to get through this, but we're going to get through it because Together Kentucky is going to pull together. And as Team Kentucky, we're going to rise to the challenge. But we're all in this together, and it's going to take all of us to get through it. So thank you again, Governor.
Thank you. Well, our tough day just got a little bit tougher. We just learned of one additional Kentuckian that we lost in northern Kentucky in Campbell County, who was in their 80s. We're still awaiting more information on that, but it appears that today we have lost 7 Kentuckians. Let's commit. We are going to do the things that it takes to make sure we don't have a lot of days like this. This is a virus that will come for our most vulnerable, and we got to make sure that we are standing there protecting them. That each and every one of us in our decisions and in our actions, when we do the right things, protects folks that are out there. Every time that we stay at home, healthy at home, instead of making a decision to do something different that would spread the virus, is protecting people. And as we see today, losing 7 people, the consequences can be real significant. But I will say, I'm still very proud of the steps that we have taken here in Kentucky, of the sacrifices that we are making. And I know, even as of today, our numbers would be significantly worse if it wasn't for what we're doing. I absolutely know it. Every modeling shows that if we continue to do what we are doing, then we will protect a lot of people out there. So I want to talk about a couple of additional steps that we've taken today. For our grocery store workers, we are expanding the child care options that we have been providing to our first responders and our healthcare workers to our grocery store workers. We need them. We know that the food supply chain is safe, but we have to make sure that we have enough people that are there stocking the shelves day in and day out. This was a change we were able to make knowing that we have the capacity in our existing facilities that are providing that child care service. We need our grocery store workers. We want to thank them for what they're doing. I've signed an executive order today that allows local, state, and counties to hire back police, firefighters, EMS, and corrections officers that have retired with no penalty to their retirement. Right now, with folks having to go into self-quarantine, and when folks test positive, it could take out an entire fire department in some areas. This is going to allow us to have a bigger pool of people to pull from. It's something that was specifically asked by our sheriffs and chiefs of police starting today, because it'll go into effect. We will have the opportunity to do that, and we will get out specific guidance to them. I want to thank our Board of Nursing. which sent over the materials that are going to allow us to ease a lot of restrictions so that we can have more nurses. I believe that that's both those that are coming into the profession and those that have recently left the profession. I want to mention to our fiscal courts out there, we need you to model the type of behavior and type of meetings that we want others to see. My orders do apply and recommend virtual, preferably video, but even telephonic meetings of fiscal courts. There needs to be a way for the public to be able to dial in and listen in or watch, but for our local governments out there, we need to make sure that we are not having in-person meetings that draw folks in. Got this question on a call earlier today, folks. No yard sales. As it gets nicer, yard sales are a way that would spread this virus really easily. From everything that we touch to everybody who comes up to the crowds that it creates, we can't have any yard sales until after this is over. We are working tomorrow and the next day on a proof of concept in Franklin County on drive-up testing. This is a practice run for us to make sure we understand the different challenges that we're going to face as we have the opportunities to stand these up in different places. We are working with some partners that we will announce as we have worked through these and know that we have everything in place to start moving this testing forward. I do want to thank the University of Louisville and its lab that's going to be able to help process the kits, at least from this proof of concept in a very rapid fashion. I do want to say that they have increased their capacity significantly since they started. We're going to connect some people that are out in the state to them so that we can turn around some kits faster. And one of the challenges that we face, and we don't have it with our lab, we don't have it with U of L's lab, and we don't have it with UK's lab, is some of these outside labs can take 7 to 10 days to get back tests. And if you self-quarantined, and if you're already in that quarantine for about a week beforehand, you may be fully through the virus before you even know that you tested positive to it. So we want to make sure that any testing that we do is effective and that we can turn it around quickly. We are in continued negotiations to work towards that day where we can do significant drive-up testing. Every day we take 2 steps forward and 1 step back, but I do believe that we are continuing to take steps forward that will get us closer. Now I want to take, before questions, the opportunity to talk about the positives that are out there, because even in a tough day, there are so many positives. And our numbers are where they are and not where they are in some other places because of your hard work. Today's number aren't a negative reflection on that hard work. It's just a reminder of how strong this virus is and the steps that we have got to take to make sure we protect one another. And what we need is positive social pressure on everyone to follow these recommendations, and that comes from you. And so I want you to keep modeling the type of behavior we need, and I want you to keep filling up social media now more than ever, and we need more of it. We need more of it to keep everybody's spirits up, but we need more of it to show everybody out there that's not following the guidelines that the rest of Kentucky is, and it's time to get on board. So I want to look at a little bit of today's social media, pick us back up, and make us recommit the way we need to. This is Morehead City Park. We appreciate the mayor putting this up. Again, this was green from 2 nights ago, and we're asking everybody to light their house or their facilities up green. And remember, tomorrow morning at 10 a.m., ring whatever bells you have, wherever you are, even if it's just something inside your house. Let's remind people, let's remind the families that suffered a loss today that we care about them, and that we are here, and that none of us are alone. Just because we're social distancing, none of us are alone. Let's go to the next one. This is U of L's campus. We appreciate what they and all of our other universities are doing and the empathy that they're showing. Let's look at the next one. And this is, again, a an opportunity to, when we're practicing social distancing, let's remember that if we are in that blessed position to be at home with our family, it is an opportunity to be with our family. Let's make sure that unit practices social distancing from other family units, but it can be a time where maybe again we get to take a breath and we get to see our kids more than we would otherwise. So, this is Jean Ford, who is Senator Wendell Ford's widow, somebody that I know personally well, and I know her kids and her grandkids very, very well, and this is her great granddaughter, Winnie. The fact that even our former First Lady, Jean Ford, is practicing social distancing during this time is something special, and it should show her sacrifice and all of our sacrifice that we've got to follow these recommendations. We love this sidewalk chalk that we're seeing out there. I mean, our kids are so incredible. They are not just resilient, but even in the face of what we see, they are optimistic and energetic and even joyful. And if we can take a little bit of their energy and their persistence and their approach to the world, that this is just another thing that's been thrown at us and we will defeat it. And let's make sure that we do it in a way that preserves our physical, emotional, and mental health. Maybe right now is when we watch our kids and we try to act a little bit more like them. These are thank you notes from our hard-working healthcare professionals. Remember, each and every one of these folks walks into danger each and every day right now. And what they're counting on you is to stay at home. Be healthy at home. The amount of risk that these folks face depend on how well we do at reducing our contacts. They are amazing. We appreciate them. To all the doctors, nurses, healthcare professionals of any type, thank you for what you're doing. And I really like this one. We still need people to be giving blood during this time. It's going to be necessary for folks that will be in the hospital. We know that it'll be done safely, and while it may take a little more courage during these times to go in and give blood than others, as long as it is in a safe environment, we need and we encourage people to do it. This is Eminent Schools using their 3D printers to help out. Again, the donations or the creation of PPE just shows an outpouring of support from Kentuckians. And this is KCO, but our Kentucky coroners and our Kentucky Medical Examiner's Office donating significant amounts of PPE, again, for every group out there that has it and that is not going to need it the way that it will be needed as this surge continues. Make sure you let us know. Make sure we can get our hands on it. This is Georgetown College ringing their bells. And James, let's save the last one right to the end. All right, folks. So again, this is the type of stuff that we need to see. We need to see out of everybody. So tonight, let's remember those we've lost, but let's wake up tomorrow ready to go. Knowing we got to work harder than we ever did before, knowing the next weeks are absolutely critical, knowing we got to be strong, and knowing every decision we make impacts other people. Now, we are filled with the best people in this country, and I believe in this world in Kentucky. I know we're up for it, and I know we're going to come through. So with that, we will open it up to questions. I have both written questions, and we've got 3 reporters that are here with us today. So Phil, you want to start us off?
Did you talk to the Williamsburg mayor about people that are not going into Tennessee and things of this nature?
The question is if I talked to the Williamsburg mayor about people not going into Tennessee or of that nature. I'm not sure I've spoken to the mayor. I had a call with county judges today where a number of them asked questions about the order about not traveling to other states, and mainly it was explaining what the exceptions are. If you're going for a job, or if you're going for groceries, you're going to care for a loved one, or it's by a court order. Either you got to be at court or visitation. If your children are potentially in there, that those are all acceptable reasons. But otherwise, it's not just Tennessee; it's any other state. We can't be traveling, but we shouldn't be traveling really to another county right now, anywhere, but for those reasons. Now, a concern that's been raised by many of those judges and officials on that border is, what about people coming the opposite way? And that's something that we're going to need to address, not in the concept that we would shut down any roads, but if people are going to come to Kentucky and it not be for the same set of exceptions, we're probably going to need to have a 14-day quarantine there too. I mean, nobody from other states should be coming to visit at the time. This is not the time for that. And if people come into Kentucky planning on visiting and staying, we're going to have to look at what options we have to quarantine folks that are coming in for those reasons. Initially, we answered the mask question. Tomorrow being April 1st, a lot of people are going to pay rent. We've gotten tips from people saying their apartment still wants to receive the rent. What do we recommend to tenants, to landlords, apartment complexes trying to collect? Well, evictions are suspended. While this state of emergency is in effect, evictions are suspended. Nobody's going to get kicked out of any place they're in. To be healthy at home, you need to be able to stay at home. Now, with that said, rent is still there and will eventually be owned. If you can pay the rent, if you can get by doing that, please do. But I would hope that every landlord and every tenant, especially with evictions being suspended, can come up with a plan, and a long-term plan to help us get through this. Joe?
I know there have been hundreds of cases.
Got two Joes. That's all right. Yeah.
Okay. Go by last name. So I know there have been hundreds of cases, but what are your thoughts about the LRC staffer that tested positive for the virus?
Question is, what are my thoughts about the LRC staffer who tested positive for the virus? This virus is going to be everywhere, and it will come on these Capitol grounds. And what it means is we ought to have everybody humanly possible working from home that can. It means that the others in the LRC and our legislators ought to be monitoring themselves to determine if there are going to be any symptoms. They ought to at least be doing some tracing from the last people that were in contact with this individual and seeing how they're feeling. But again, what it says to me is these folks need to pass a budget and get out of town for their own health and for everybody else, and to model the type of behavior that we need to see. Now, my understanding, at least as of now, is that's the plan. Is that all they're looking at the moment is coming in, passing that budget, and going home for at least a period. Should those who are already on unemployment expect some delays in processing their payments due to the high volume of new unemployment claims being filed? We do not think that payments will be delayed because of the new claims that are coming in. I can get confirmation on that, but right now we do not believe that'll be the case. I got a question from the State Journal about what we were talking about, our proof of concept site. Right now we're going to do a couple days just to prove that we can do this before we're gonna try to set up at least the first of these facilities for the public. When we get to the drive-up testing phase, please understand that there's still a very limited supply. And what we're going to be looking at are those that are the most vulnerable, 60 plus, with underlying conditions that also show symptoms, as well as first responders showing symptoms or in quarantine. When we start this, those are going to be the different groups that we're going to have to prioritize because of the damage it can do to one group, and because of the fact that we've got to get our first responders, especially that are in quarantine, back out helping us. Those will be the priorities there. Joe.
I have another GE question. Workers in Louisville returned to the plant yesterday, and some were upset about the working conditions there. They said that things hadn't changed, they hadn't been cleaned enough. Union president is now quarantined there. Do you have any concerns at all about GE opening that plant back up and the conditions there?
The question is on GE and different concerns from the workers and my concerns in reopening the facility. I worry about every facility in Kentucky right now. I worry about everywhere with this virus, but understanding that businesses that fall within our order as being life-sustaining, it's important to have the opportunity for them to continue. My hope is that the changes that GE has made are only the start, and that every single day, every facility, every store, everything that is open in any way to the public or groups finds new and different ways to ultimately lessen the opportunity for the virus to spread. I do hope that both the company and the workers can continue talks and can come to a place where the workers feel like GE is taking extra steps, and that GE has workers that feel safe coming to the facility. I know we're not there yet, and this is it's a scary virus to all of us, and so I understand how talks that normally might not escalate on any side as quickly can. I mean, based on the fear and on the anxiety, and we still want to help out of the governor's office in ways that we can, but that's one that's still in process. Other Joe.
As far as the budget goes, the lawmakers are talking about the possibility of only passing a one-year spending plan, and that's in light of all the kind of chaos that comes around with revenue projections at this time. What are your thoughts about the possibility of the legislature only sending you a one-year budget?
The question is, there's talk that the legislature may send or only pass a one-year budget, and what are my thoughts on that? I can't recall that ever being done before, but I also can't recall a legislature meeting in the midst of something like this. If a one-year budget is what lets them come in, pass something, and go home, that's the best thing for their health and everybody else around them. We'll work on it from there. But listen, I want them to be safe. I don't want them to spread the virus amongst each other and then back in their communities. We really need, and I don't mean this from a negative standpoint, to get them out of town. I mean that from the reduction of contacts everywhere across Kentucky. And a one-year budget, I mean, normally we pass a biennium. It's not ideal, but we're not living in an ideal world right now. And I'm willing to be flexible enough with the situation that we face. Are there any updates on, here, let me go back. Will the state be offering remote options for signing wills or advanced directives, maybe electronic signatures or video conferencing? So now we can notarize things through video. That solves a number of those issues, but we'll continue to work through everything, including a will or advanced directives. At this point, we've got to be able to do remotely. And if there are any impediments still in the way, we need to work with the Bar Association, the courts if necessary, look at our laws and do what it takes to address it. Are there any updates on state workers like the Highway Department who have to still report to work every day? Well, I hope that we don't have a full department anywhere in state government that has to report in person to work every day. And if that's the case, I'm going to fix it.
Are you considering ending the school year early?
The question is, am I considering ending the school year early? Given that the president has now moved his recommendations to the 30th of April, we're going to be looking at this week on our thoughts of our directives and our recommendations, including to school systems. If we make a move, it would likely be similar to what the president did and extend it a couple more weeks. Still wanting to see, because again, none of us know, even though we try to do our best guesses about when this virus might peak, and wanting to make sure that we still at least have the opportunity for kids to go back to school this year. I do think it is more than in the realm of possibility that there won't be any more in-person classes in school this year. We got to at least be prepared for it, and I know our superintendents have been making those preparations if that is the case. What's my advice to those that have had their claims denied? This is on unemployment. Again, we're working off a system that was designed for a different world. We are working as hard and as fast as we can. We are hiring a significant number of people. I'm going to ask Josh Benton to do a longer version tomorrow that goes through the most frequently asked questions and how we're going to address them, give you some specific details for those that have signed up for unemployment as an independent contractor and been told you don't qualify. You do qualify. We need to have your stuff in the system. What we can't necessarily control, and we're working on it, is what the system spits out to you initially. Now, we need to do a better job in making sure we can circle back around to you and say, don't let that email get you down. You're in the system, and we're going to process you. Those are all things that we're working on day to day, minute by minute. We will do our best to get there as quickly as we can. Could the 64 Kentuckians who've recovered from the coronavirus help in developing a vaccine since they have antibodies in their blood? We still do not know the level of immunity of antibodies that people are going to have as they come out of this. We certainly hope that they have some level of immunity. And if they do have a level of immunity, it might not be this that we will ask of them. But if there is a significant level of immunity, which again, none of us know, they might be some of the most effective frontline healthcare workers that we could ultimately bring to help those that are sick as they're going through this. Some churches are hoping to worship through a drive-in service, especially on Easter Sunday. What would the governor and medical folks think about that? First, the drive-in services are really creative. And thank you to our churches and our houses of worship for trying to find a new way. If you're going to do them, please follow some really important rules. Number one, no more than a single family that lives together in a car. Number two, cars have to be more than 6 feet apart because it's going to be nice weather and people are going to roll down their windows. Number three, nobody can get out of their car, right? It's defeated if people roll up in their car, and that's the way that it's supposed to be, and then everybody gets out. And number four, we can't pass things between cars. And I know that's really hard with communion. That's really hard with offerings, but we can't be passing things that people are touching between them. If all of those can be followed, I think that this type of service is something that, again, people can feel together on. I appreciate our houses of worship thinking about different ways to do this. I think that those are they're very legitimate rules. They're rules that ensure we're continuing to apply the CDC guidelines. And the last thing we want is for an Easter worship service, which is about rebirth, and to ultimately spread the virus and to harm people. And let me just again say, to the very few exceptions out there that are encouraging congregations to come together, especially our elderly in the communities, those actions won't just spread the virus, they'll kill people. Please don't do it. It's not a test of our faith. Look at all the congregations that are out there, almost all of them, that are doing the hard thing, but the right thing. And these are congregations that have always believed that you need to come to church physically, but they see the times and they want to protect their members. Again, please be a part of that, not trying to be a part of the exception. Phil?
With another question about the budget, I believe that David Osborne basically said last week that there would probably be no raises for anyone, and no increases for higher education. I know that's something that you ran on, but given everything that's happened, your thoughts on that?
The question is on the budget and whether or not it's going to have any raises or increases for education. We'll have to wait until we see it. Yes, I ran on wanting to my draft budget had $400 million new dollars plus going into public education. It had raises for state workers. It had raises for teachers. It had more social workers out there to protect our kids. It was a true opportunity budget to help us step forward. And it was before the coronavirus hit us. Unlike everybody else out there who is having to make sacrifices, at least what I want out of the budget is going to have to be a sacrifice too. Right now, this budget is going to be about maintaining, is my belief, and about making sure that we can get through this crisis and come out on the other end. And let's just say none of us know None of us know that we're planning what it's going to look like on the other end. How quickly our economy will pick back up, and my hope is real quickly. None of us know the amount of federal stimulus that's going to be provided. It's going to need to be really significant. And if it is, then we could always have a special session on the budget to use that money to do all of the good things that we wanted to. But right now, we need to make sure that we have the dollars to maintain things. But listen, the only thing we ought to be focused on right now is the coronavirus, and we can always address budget opportunities or deficits on another day. Let's see. Do I plan to open up child care services to grocery store workers? Yes, we did that today. Have I ordered rest areas to shut down? No, at this point. As long as we can engage in the social distancing, we want to at least try to keep those rest areas open. But again, everything is contingent on people being able to engage in that social distancing. There was a letter from CHFS sent out warning of rescinded masks made by Handon, Henyong Protective and Clean Products Company. That is true. Those are defective, bad masks. We wanted to make sure that nobody was using them. Tennessee and Indiana have higher testing counts, leading to higher positive cases. Why are Kentucky's testing numbers so low? We don't believe our testing numbers are low. We just believe that the reports that we get back in of negatives and other tests, we are not getting the same level of reporting back as other states may be getting, or they could potentially have even more tests than they're reporting. Again, it's something we're continuing to work on. Tomorrow we're going to be having calls coming directly out of the governor's office to the various labs to get the numbers as of that day, going back in time throughout Kentucky. This is something that we got to fix, and our in-state actors are doing a lot better. We got to make sure that we're getting it from everybody. Let's see, from the Washington Post, as I understand it, by the end of last week, Kentucky State Lab had a 2-week backlog when it came to reading tests, which was one reason there was a delay in launching mobile sites in the state. That is not accurate. We get all of our tests done from the state lab in 12 to 24 hours. Our delay in launching our mobile testing is based on having the number of testing kits that we need, is having the full amount of PPE that we need, and making sure that we have a lab that, to the scale we're talking about, which is more than our state lab could, can turn it around in enough time to where it can be helpful. We'd like to get reports back in 48 hours. Now, I will say we are getting really close to that. But every time we've gotten really close to making an announcement, one of those pieces hasn't lined up. And I want to do this, but I want it to work. I want it to work. I want to make sure that when we launch this, it truly helps us. And we're not doing something just to do it or just to have cameras there and show that, hey, we have drive-up testing, but 10 days later you get your results. That's not going to help us. I want to make sure that we do it right and that it is a tool that better protects us here in Kentucky, and that's the reason for the delay. But the other is I got to see it. I got to see that we have the number of kits and we have the people, though we're not concerned about that anymore, that we have the PPE. I've got to see it to tell the people of Kentucky that we are ready to do it. I mentioned the possible release of Department of Corrections inmates at the press conference yesterday. Will people within, okay, and then there are some very specific questions on here. What I can say right now is what I'm looking at are people whose sentence is nearly over and are set to be released for nonviolent, non-sex related offenses, and those that are medically fragile. And we're still working through that list. It becomes much more complicated once we get down to the numbers, and it's taken more time than I would like it to, but we are still working through that process. Response to Our Lady of Bellefonte Hospital: is there anything the state can do to mandate it will remain open? So I was asked this question yesterday, and I said, of course we're going to need that hospital when this surge hits. Then apparently the hospital system responded that they're closing at the end of the month. Listen, we're going to use that building. We're going to use it. Whether or not the hospital system is operating at the time, we'll operate it with somebody else. But we're going to use that building, and I'd like that hospital system to try to hold on. I know that it was aged infrastructure and other issues that before the coronavirus were leading to the situation that they were facing. But if there's any lack of clarity, I'm not talking about a hospital system. I'm not talking about a company. I'm not talking about a nonprofit, not-for-profit. I'm talking about an actual physical hospital, even if it's shut down for a couple days or a couple weeks. We're going to need, and we're going to use, and we're going to take advantage of those beds. We're going to do that everywhere. So let's look at our key numbers, which are our numbers of hospital beds, our number of ICU beds, and our number of ventilators. So we really think about three things that we're doing when it comes to this virus. Number one, we're trying to reduce its spread. That's all our social distancing. That's all of your sacrifice. Number two, we are working on getting more testing every day to try to get to the point where we could test and isolate as much as possible. And number three, we're trying to increase our healthcare capacity. So when the surge comes, there are enough beds, there's enough ICUs and enough ventilators. This is what's created the crisis in New York, and as we're seeing in New Orleans. It's that when the cases spike, are there enough of all of these? Now, every time you reduce a contact, every time we slow the spread of the virus, it gives us more time. It gives us more time to increase our capacity, and the more we can spread it out, and the more the virus has run its peak course in other areas, the more it's going to be available from other places in the United States as we move forward too. In other words, if we can slow this and we peak last, there's going to be more out there. We're already working on numerous plans to increase our hospital beds, and we already have at least plans to increase that by 10%, and making plans to increase that by significantly more. We're out there getting every convertible ventilator. I know there are at least 70 approximately that are out in Kentucky that can be easily repurposed, and we're looking at other versions in other places to make sure that we have brought together all of those resources. And then there's a question, if I've been told if a positive case in Boyd County was an employee of a specific entity, and no, I don't have that information. So let's take two more from here.
You were just sent a letter recently, you probably haven't seen it yet, but it was from a pretty wide range of groups on the left and right calling for specific reforms on getting people out of state prisons as soon as possible, same time as something happens. You mentioned before what you're looking at. How soon can we expect actually?
And my hope is that that plan will be finalized this week. I will admit it's taken too long to put together, but it's more complicated than the letter and the suggestion. For instance, I think that letter says all Class Ds. Well, there are folks that have been convicted of a Class D felony that use the internet to try to lure a child and actually showed up intending to sexually assault that child. And they may be in their first year of a multi-year sentence on that, and I just view that differently than some other Class Ds. And so we're trying to be thoughtful about it, but we do need to pick up the pace more than we have. Anybody else? All right. So Kentucky today, we had a tough day, and there are going to be more tough days ahead. And I want you to be ready for days that we're going to have both more cases and also more deaths than we've had today. But everything you do all day, each and every day, collectively when we put all of that together is how well we're going to be able to deal with this virus. While I'm out there every day fighting for PPE and testing kits, know the one thing that we can control here in Kentucky is how well we do on social distancing, is how well our behavior flattens that curve. This is the part that we can truly own. So we need everybody doing their part, and we need everybody encouraging everybody else to do their part. This is the challenge of our times, and this is our chance to step up. It is our test of humanity, and I believe we will pass it. And just imagine if we could look back 5, 10 years from now and remember the time when we put our fellow human being above ourselves and above everything else. This is a chance to not only come together by staying apart, to do the right thing, but to reaffirm everything that we share in common. You know, before the coronavirus hit, we may have been more divided than I can ever remember. But right now, it's just us versus this virus. What we do every day matters. And so I want to end us today with a video of some of our young people doing their part, again, being creative, finding ways to connect even though they're apart. This is the type of positive social pressure where people see how much fun they're having, how good that their product is, and hopefully that encourages others to do the same. I believe this is from Danville Christian Academy. We want to thank, I believe it's their volleyball team, for helping to put this together. I'll see you tomorrow at 5. Light those houses up green. Ring those bells at 10 a.m. tomorrow. Think about the 7 Kentuckians we've lost, and then recommit. Recommit to doing everything you can to defeat this coronavirus. Thank you all. Thank you, Virginia.